Good afternoon, everyone. Today, I, Dr. Neal, would like to present a seminar on the Bhatia battery test. We will be covering the seminar under the following topics. We will go through the introduction. We'll talk a little about battery tests. We will then go to the introduction to Bhatia battery test. Then we will go to the different components of Bhatia battery tests. And then we'll also discuss the limitations and in the end summary. In context of psychology, what is a battery? A battery is a group of several tests or subtests that are administered at one time to one person. So oftentimes we see that there are a lot of tests which are singular. But when a lot of singular tests are collected together, it is called a battery. When several tests are packaged together by a publisher to be used for specific purpose, the word battery usually appears in the title, and the entire group of tests is viewed as a single whole instrument. A test battery gives a broader and firmer base for assessment that isn't possible with individual tests. So it could be that one person has given many tests and then combined them to make a battery, or it could be that there are various different tests which have been combined by one person to make a certain type of battery. Several examples of this usage occur in neuropsychological instruments such as the Halstead-Wrighton neuropsychological battery, where many cognitive functions need to be evaluated by means of separate tests in order to detect possible brain impairment. The term battery is also used to designate any group of individual tests specifically selected by a psychologist for use with a given client in an effort to answer a specific referral question, usually of a diagnostic nature. So it may not be that you always pick out an already formed battery. Even you can collect a few tests and term it as a battery for your own diagnostic purposes. A typical battery of tests includes projective tests to assess personality, such as the Rorschach and the thematic appreciation test, and objective personality test. Now, these are some examples of batteries. An objective personality test, such as the Minnesota multiphasic personality inventory, a semi-structured test like the Rotter incomplete sentence test, an intelligence test, usually the Welch's adult intelligence scale revised. This is one of the commonly used tests. Niemann's neuropsychological battery for the elderly. This is used for cognitive and dementia. And Bhatia battery, which is a type of intelligence test. Now, what are the different types of intelligence test? Now we can do them, do the classification on the basis of administration or on the basis of posts. On the basis of administration, it can be an individual intelligence test wherein tests are given one-on-one by a certified evaluator, most commonly used for educational placement decisions like course block test or pass analog test. Now course block test is also a part of Bhatia battery. It could also be a group intelligence test given to a larger group or whole class administered by teachers as a screening process to determine who differs from the average, and a closer look or individual test like Army Alpha test, Army Beta test. This is when you use it as a screening test for a larger group of individuals wherein you want to find individuals. And on the basis of post, it could be verbal intelligence test, non-verbal intelligence test, performance intelligence test, non-language intelligence test. Now we'll move on to the Bhatia battery intelligence test. Bhatia's battery of performance test of intelligence, popularly known as Bhatia's intelligence test or Bhatia battery simply, is one of the popular intelligence tests in the Indian subcontinent. Chandra Mohan Bhatia, former director of Uttar Pradesh Manovigyashalaya, constructed this test for Indian population in 1955. So it was given by CM Bhatia in the year 1955. The battery of tests consists of 5 subtests: Coase block test, Alexander pass along test, pattern drawing, picture construction, and immediate memory tests. So these are the 5 components of the test. The battery is standardized on Indian boys in the 1950s for ages between 11 to 16 years old. The battery yields overall intelligence questions (IQ) based on all the 5 subtests and performance quotient based on the 4 performative tests. The test's IQ as well as PQ range is relatively restricted between 69 to 131. It is probably one of the pioneer tests of IQ that dealt mainly with performance subtests / items. The main reason for the popularity of Bhatia battery is that it is a performance test and hence can be administered to people with language incompatibility or poor verbal abilities. There are also two forms of it. One is for the literate population and one is for the illiterate population. It can be used in some cases to children suspected of specific learning disabilities, where the examiner is sure that the child has average intelligence, but examiner wants to objectively prove that the child's intelligence is average. It takes relatively less time, 30 to 45 minutes to administer the test. The subtests are interesting, where block design test has wooden blocks with bright colors. Picture construction test has drawing pictures that represent the Indian subcontinent / culture. Pass along test has sliding past parts. Pattern drawing test requires drawing lines with interesting conditions. This automatically increases the cooperation as well as motivation of the subject / patient. It has separate set of norms for literate and illiterate people, which apparently seems appropriate given the illiteracy rates in the country and hence appeals to substantial number of professionals. And it is easy to administer and score. So these are the 5 subtests under the Bhatia battery. Course block test, Alexander's pass along, pattern drawing, picture construction, immediate memory tests. So now we will look at all the 5 different tests that are there in the Bhatia battery. Course block test, it measures the ability to analyze and synthesize the visual motor coordination. What is the procedure? 4 cubes are placed before the subject. All are alike and colored in different ways. The subject handles and examines the cubes to become familiar with each of them. Card number 1 is then shown to them and the design on the card has to be constructed by the subject using 4 cubes. Now, for example, I have 4 cubes with me over here. So what I will do is I will give this 4 cubes to the patient or the person whose IQ I'm testing, and I will tell them that you have to use these 4 cubes. So every cube has a yellow, red, white and a blue. So 4 colors. And then they will be shown certain pictures and they have to keep the cubes in a certain way that the picture is formed by the cubes. So for the first 5 uh, pictures that I will show, I will give them 4 cubes. So this is basically a picture and here we can see that the person is using 9 cubes. So for the first 5 we give 4 cubes. After that, for the next 6th to 9th one, 6 to 8 one, I will give them more cubes to make total 9 blocks. So even if the subject attempts to prepare the design himself, demonstrate this design to every subject. And you will mix up the blocks and ask him to prepare design number 1 already shown to him. So this is if he fails it, all you do is you mix up the blocks and you give the blocks again to him and you tell him to do it again. If the subject succeeds within 2-minute time limit, he is asked to construct design number 2. So you give them the block, the patient is able to do it. Okay, within 2 minutes you move on. If the patient is not able to do it, you pick up the blocks, you again shuffle them, you give the patient again, and they have to again do it within 2 minutes. If it is done within a 2 minutes, it is a pass and we move on to the next picture. The test proceeds in this manner with successive designs. At the start of design number 6, 5 more blocks are given to the subject, bringing up the total to 9. As we had seen previously, that image was for 9 blocks. And at design number 8, the remaining 7 are given to make a total of 16 blocks. So it is initially 4, then 9, then 16. The test stops when the subject fails twice in succession. And the time limit for design number 1 to 5 is 2 minutes each, and for 6 to 10 is 3 minutes each. So how do you score? Maximum someone can score is 25 for first 5 designs, and for each designs 2 marks for succession within a minute, 1 mark for succession between 1 minute and 2 minutes, and 0 marks for a failure or succession after the time limit. So you basically sit with a sheet and you write 1 to 10, and depending on if the patient was able to make the design in 1 minute, you will give 2 marks. If 2 minutes, then 1 mark. If the patient is either exceeding the time limit or not able to do it at all, you give 0 marks. And for design 6 to 10, for each design, 3 marks for succession within a minute, 2 marks for succession between 1 to 2 minutes, 1 mark for succession between 2 to 3 minutes, and 0 marks for failure. So we can see 6 to 10, 3, so that is 15, and 2 to 5, 10, so that is 25. So that is how maximum score that you can get is 25. Second is the pass along test, measures ability to profit from previous experiences and motor coordination and control. What is the procedure? The subject takes the first smallest box together with card number 1. So like you have this box. So this box has various boxes and you have to arrange or move them, and you are not supposed to pick the block. Procedure: the subject takes the first smallest box with card number 1. It is pointed out to him that the red block has to be placed near the blue end of the box and the blue block near the red end. So it has red or blue ends. The subject is told that it is emphasized that the block must not be lifted but may only be moved horizontal. The solution of the first box is demonstrated to the subject. So you will show how to do one of them and then tell the patient to do again. So these are the various designs that you have, and there are various blocks like this, and you have to move the blocks and make the design of the picture that has been given to you. So card number 1 and the first box are again placed before the subject, who is asked to do the same as before. So because the patient has to be oriented and has to be explained how to do it, we will show him one of them, which is on card number 1. Then we will again mix up the blocks and give it to him again to be done. Success or failure within a time limit is recorded. The experimenter then proceeds to design number 2, 3, etc. with the appropriate boxes, after placing the boxes in the required initial position. The initial positions are obtained simply by reversing the colored ends of the blocks. The box is placed before the subject with cubes arranged as on the design card, which is presented to the subject with the number facing up. The test stops when the subject fails twice in succession. The time limit of design 1 to 4 is 2 minutes, and for design 5 to 8 is 3 minutes each. So again, there is a time limit, and depending on if it is design 1 to 4, you get 2 minutes, and if it is design 5 to 8, you get 3 minutes each. So how is the scoring done? For the first 4 subtests and for each subtest, 2 marks for success within a minute. So for the first 4 drawings, you have 2 marks for success within a minute, 1 mark for success within 1 to 2 minutes, and 0 marks for failure or success after the time limit. And for the last 4 subtests, there are 3 marks for success within a minute, 2 marks for success within 1 to 2 minutes, and 1 mark for success between 2 to 3 minutes. 0 marks for failure or success after the time limit. So again, you will keep a page and you will write 1 to 8, and depending on if it is 1 to 4 or 5 to 8, you will score it. Procedure: pattern drawing test. This consists of 8 figures of increasing difficulty from 1st to 8. A card is placed before the subject, displayed so that the number of the card appears on the top of the subject. The subject has to draw the figure as shown on the card without repeating any lines and without lifting the pencil off the paper once he has started. So in the third test, you cannot lift the pencil. In the second test, you cannot lift the block. The card remains in full view of the subject throughout. The subject attempts to draw the design on successive cards and is allowed as many attempts as needed within the time limit. Demonstrate the pattern if necessary. It is only meant to give the subject confidence and facilitate in drawing. When a failure occurs in one of the patterns, demonstrate but do not let the subject try that pattern again. The test stops when the subject fails twice in succession. A maximum of 2 minutes is allowed for each design 1 to 4 and 3 minutes for pattern 5 to 8. So these are the drawings that you tell the patient to draw, and no line has to be repeated. So no overwriting over the line is to be done. and you are not supposed to lift up the pencil. So if the patient fails to do it twice, you move on to the next one. Scoring, maximum score is 20. For the first four, 2 marks for succession within a minute, 1 mark for success between 1 minute and 2 minutes, and 0 marks for a failure of succession after the time limit. For the last four, it is 3 marks for success within a minute, 2 marks for 1 to 2 minutes, and 1 mark for success between 2 to 3 minutes, and 0 marks for failure after the time limit. So marking scheme has been pretty consistent throughout. Immediate memory for sounds. Direct immediate memory is closely related to mental development or general intelligence. The subject has to repeat a sequence of letters as told. The sequence should be read out distinctively and with intonation. So, ta, tha, da, la, whatever you're going to give it, it has to be very clear when you're reading it out to the patient. To give the subject practice, the test starts with 2 letters. The experimenter then proceeds to increase the number of letters one at a time until failure is recorded. At each level, 3 alternative sets of letters are given. If the test subject fails on the first set, the second and then the third alternatives can be given. If the subject fails all three, the test stops. So here we have, for immediate memory test, we have sounds forward. So b, ch, l, t, l, p, ch, r, ch, s, k. So these are 3 sets, and you read out one of the sets and the patient has to repeat what you have said. And for English, we have numbers like they start with 2, 4, 7, 6, 3, 5, 8, and they go all till 9 digits. And then you have to also test reversed. Here the subject has to pronounce the letters in reversing orders. The experiment continues the sequence until failure is recorded, meaning failure in all 3 alternatives of a particular set as previously. So here you have direct, and then on the other side they have given reversed. So they have also given an example, ka, cha, ta. So the patient will say ta, cha, ka. So that is how you repeat the sounds backwards. And for English patients, the digits are also given over here reversed. So you just read out the either the digits or the alphabets, and the patient is supposed to repeat them. Scoring, maximum score of 15. Now there is direct and reverse version. Direct, 1 mark each for the number of digits or sound in the maximum correct reproduction, and in the reverse, 1 mark each for the number of digits or sound in the maximum correct reversed reproduction. So you will give 1 mark each for every sequence that the patient is able to repeat. So as we can see, there are 1, 2, 3, 4, 5. So 5, that's how 15 will come. Now the picture construction test. The pieces of a puzzle are placed in front of a subject. All the pieces have to be put together to make a picture. The test consists of 5 different pictures for the subject to construct. The test stops when the subject fails twice in succession. The time limit is 2 minutes each for pictures 1 to 3 and 3 minutes each for picture 4 to 5. So here we can see that there are pictures of different sizes. So depending on the difficulty, we will give them a block of pictures, and they have to reconstruct the pictures. It is basically a jigsaw puzzle, but there is no jigsaw in it. It's just plain boxes that the patient has to arrange. So this is an example of a test wherein there are total 12 blocks that the patient has to arrange. Scoring, maximum score is 15 for pictures 1 to 3, and for each of them 2 marks for success between 1 to 2 minutes, 1 mark for success between 1 and 2 minutes, 0 marks for failure or success after the time limit. For pictures 4 and the first point is 2 marks for success between before 1 minute, and 1 mark for success between 1 and 2 minutes, and 0 marks for failure or success after the time limit. For pictures 4 and 5, 3 marks for success within 1 minute, 2 marks for success between 1 and 2 minutes, and 1 mark for success between 2 and 3 minutes, and 0 marks for failure or success after the time limit. For picture 4 and 5, however, credit in addition is that addition to be earned according to the above schedule is to be given as under. For picture 4, 1 mark provided. So there are total 6 parts for the picture 4, and if the patient is able to put all of the 6 parts, then he will get 1 additional point. And for picture 5, there are total 12 parts, and if he is able to do it under the time schedule, he will get 2 extra marks. So for picture 4 and 5, the patient gets additional bonus points. Now for this interpretation, add the raw scores of all the 5 tests and get a total raw score using the tables provided for both literate and illiterate individual. So along with the Bhatia battery test, you get a conversion test which you have to use. So it is something like this, wherein you add all the raw scores. This is for the literate group and this is for the illiterate group. And according to the age 11 to 16 and the scores, depending on that, you will give them their IQ. So using the tables provided for literate and illiterate individuals, convert raw scores in IQ. For performance quotient, first obtain weighted scores from raw scores for each of the performance tests, that is scores all the 5 tests, and add the 4 weighted scores using table 18, literate and illiterate, to obtain the PQ. Now, what are the major limitations for Bhatia battery? It is standardized more than half a century ago. So there are some questions that the standardization was done somewhere in 1950. So is it still valid after more than half a century ago? Then the fact that standardization was mainly done on boys. There were no girls included in the standardized sets. So recent popular intelligence tests do not have separate norms for the boys and girls. However, one of the important facts to remember is that recent intelligence tests include females in standardization as one comprehensive sample of the population. So in the modern tests that we are using for IQ, we have not only taken boys or we have not only taken girls. They have included the entire population in the in the standardized form. Whereas when Bhatia battery was done, this was done in 1950, they had only taken boys in the sample. Therefore, when females are included in the standardization sample, and then the obtained norms can automatically be used irrespective of whether the person is male or female. Now again, the standardization was only done for 11 to 16. So a lot of people say that can it also be used for people who are above 16? The battery norms are restricted to a narrow range of age between 11 to 16. However, some professionals do administer this battery on adults who are much older than 16 years of age. The maximum higher age it is administered varies across professionals. However, it is observed to be around 50 years. One of the possible arguments put forward by such professionals for its use in adults is that intelligence rarely increases after 16 years, and hence the 16th year norms could be used for adults. So this is a little bit of a debatable topic. It changes from professional to professional. Usually the test is only meant for 11 to 16 years of age, but some professionals do it even after that using the 16 years block as standardization. Bhatia's short form, now it is also a 45-minute test. So a lot of psychologists have also come up with their own shorter forms of Bhatia batteries. So the administration of Bhatia battery full takes about 45 minutes. Given the significant disparity in psychologist to patient ratios, and especially where time is a limiting factor, test developers usually come up with a short version of the full assessment versions. So a lot of times it can be that the patient has not gone through the entire Bhatia battery full, and it could be that the psychologist has come up with a shorter version of it and administered it. So that also is seen as a limitation. The norms range only between 69 to 131 IQ points. One of the major limitations usually talked about Bhatia battery is its apparently limited IQ range that it provides, which is only between 69 to 131 points. Usually intelligence tests provide IQ as the final output value. Always go beyond 69 to 131 IQ on both sides, especially the lower side where it is expected to indicate and differentiate the type of intellectual disability. This is not expected of those intelligence tests that provide the final output value in terms of percentile points, such as the Raven progressive matrices. So anyone which gives a certain IQ score gives IQ scores which are much below even 69. So this again forms a major limitation, because if we want to evaluate the patient for intellectual deficit or mental retardation, we might have to obtain values which are much below 69. For example, the standardization that has been done is around 140 to 169. We say that it is a very superior IQ. 120 to 139 is superior IQ. 110 to 119 is high average. 90 to 109 is where we say the normal or average IQ lies. 80 to 89 is low average. 70 to 79 is borderline defective. 50 to 69 is moron. 25 to 49 is imbecile, and 0 to 24 is idiot. So these are the standardized IQ ranges that we have and we clinically use, whereas the Bhatia battery is only providing us an IQ from 69 to 131. So the lower IQs, which is often seen in a lot of patients, cannot be found using the Bhatia battery. So this becomes one of the most major limitations of the Bhatia battery test. So in summary, I would like to say that the Bhatia battery is a very easy test to administer, and after some training, it can be administered by both psychologists and psychiatrists, and it comes with a very standardized IQ output, though it has some limitations, but it has been used in the Indian subcontinent since a very long time. And like we have even in our psychology department, we have the Bhatia battery, and we have all the components intact with us, in which even we can apply the Bhatia battery on the patients. Thank you.